on effect of mechanical traction in osteoarthritis knee. Objectives, definition of traction, physiological effects of traction, types of traction, limitations of manual joint traction, mechanical traction using knee traction device in OA knee traction device, principle of knee traction device's advantages, procedure of application, contraindications, and clinical application. So let us start with traction. So traction is the technique of applying a distracting force to produce either a realignment of a structural abnormality or to relieve abnormal pressure on nociceptive system. So we have so far seen manual traction and of course mechanical traction in terms of cervical traction, lumbar traction. So this is a bit new concept of adding knee traction in OA patients. So what are the physiological effects of traction? It stretches fibrotic tissue and adhesions and relieves compression effect on articular tissues. It relieves spasm, increases vascular and lymphatic flow. It helps to restore elasticity. It stimulates proprioceptive reflexes, thus relieving associated pain and tenderness. In the spine, it encourages the expansion and contraction of the disc tissues, thus improving their nutrition. Thus, traction encourages length, alignment, and functional stability. So we are very well aware of the physiological effects of traction. So we are going to use these effects and see what effect it has in osteoarthritis knee. So effect of joint in OA knee. So in prior studies, it is seen that manual traction is found to be very effective in treating osteoarthritis knee. But we'll see what are its drawbacks, why we came up with this new device. So compressive force acting on knee joint during activity causes deterioration of the joint structure, which leads to narrowing of joint space, causing worsening of osteoarthritis. And this compressive force can be overcome by traction. So types of traction. There is manual traction, mechanical traction, continuous traction, intermittent traction, skin traction, and skeletal traction. Now we'll see what are the limitations of manual joint traction. So usually you might have seen manual joint traction, which is used for mobilization purpose as well as it is used in knee joint also. But it has some limitations. Limitations like limited maximum traction force. So we cannot apply traction force which is exactly required. Okay, so if the person is obese, overweight, or the therapist is lean, at that point we cannot apply the exact force required. Then we have to depend on either other therapist or the traction force is not effective for the patient. Amount of force can't be easily recorded and reproduced. So whatever force you are applying for manual joint traction, it cannot be recorded. I mean, it cannot be quantified. You cannot say right now I'm applying 10 kg force or 20 kg force. You cannot quantify it. You cannot give grade to it. Okay. And same force cannot be reproduced. That means, suppose one day you gave, suppose some sort of force, might be it was 5 kg sort of force to patient. Next day when patient comes to your OPD, you cannot say you are applying the same force again. So it was not recorded or it cannot be reproduced. It can't be applied for prolonged period of time. Suppose the same force requires holding for 5 minutes, 10 minutes. So afterwards what will happen? You will get tired, or else the force which was there at the start won't be the same till the end of the session. So it cannot be applied for prolonged period of time and it requires a skilled clinician. So what are the drawbacks and limitation of skin and skeletal traction? So this is the skeletal traction where we wrap a skin with some tissue, with some technique, so that the wrapping gets adhered to the skin and the traction force is applied. So for the student purpose, I have put the image so that they can understand what is skin traction. So in this you can see the skin is given traction, and the limitation is that you can apply only 5 kg or less than that if weight is required. But if more weight is required to give traction, then you cannot use skin traction. You have to opt for skeletal traction. This is the skeletal traction. Skeletal traction has its own drawbacks, that is, nerves and blood vessels can be impaired or can cause skin lesion. When the wires or pins which are crossing through the bone, they can cause damage to the nerves and blood vessels. Also, there can be infection around the incisions of pins and wire. So where there is an insertion of pins and wires, there can be chance of infection. So these are few of the limitations. That's why those can't be used effectively for treating osteoarthritis knee. So we have a new approach, that is mechanical traction using knee traction device in ONE. So first let me introduce what is knee traction device. So this is the small model for knee traction device. Here you can see the pulley and stand. So we'll see parts of it in detail. So these are the components of knee traction device. So this is the pulley. Pulley is the very important part of this because it gives the angle of pull. So the angle of pull which we require for distracting or giving traction to the knee joint, that is provided by this pulley. Then this is the fixed pulley bar. Then these are the vertical bars, horizontal bars. So all these bars make up this knee traction device. So this is the adjustable stool which is required for positioning the patient. It is adjustable, so it can be used for many patients. So you can adjust the height according to the patient's height and length of the knee. So it is adjustable in two ways, upward, downward, yeah, else you can adjust to and fro. So those are adjustable in two ways. So this all is the main frame. So on this main frame, these all things have been mounted upon. So this is the way how you apply. So just like in cervical traction, lumbar traction, you have cervical belt, lumbar belt, ankle belts. Likewise, there is a knee traction belt which is being formulated by me. So this is the knee traction belt. So knee traction belt, we have to wrap this around the patient, tighten it with the straps over here. Then there is a hook or a loop through which we have to pass this wire or the rope. And this wire or rope is passed through the pulley. And this pulley maintains the angle of pull. So a pulley is very important in giving traction to this patient. And this all setup is then being applied or connected to the traction unit, the same unit which we use for cervical or lumbar traction. So this is the frame which has to be mounted, and on the frame then we have to position the patient. And now we'll see how to position the patient, what are the parameters which are safe for the patient, which can be applied effectively for osteoarthritis knee. So this is the way how patient has to be positioned on the traction table. So see here, hip and knee should be in 90 degree position. So there are many other techniques to position the patient, like using pillows and all, but we cannot achieve 90 degree, as we have to keep on changing the settings always. So this was the frame where we can adjust the things upward, downward, yeah, forward, backward, and the pulley which gives exact force required, exact pull required.